Yeah, so the question about the role of managed care in referring patients into clinical trials, where we have talked with organizations about working with them collaboratively to advance patients appropriately into clinical trials. We're not specifically an organization that's focused on enrolling patients in clinical trials. Those are certainly considerations for private practice oncology groups, certainly very much in the ethos and the fabric of academic cancer centers and NCI designated comprehensive cancer centers. So we don't see our role specifically. We're looking to advance through data analytics information that can help our clinical partners to make better clinical decisions, but we're not in the clinical trials world per se. So the question about targeted therapies and hematologic malignancies, they have been transformative. So there are absolutely, the CML example that's used all the time, where a very targeted specific therapy that addressed a certain defect of Philadelphia chromosome really fundamentally changed that disease and moved it into a chronic condition, much like you would have for diabetes or asthma or something like that. So, and there are other examples. In the realm of, we were talking about multiple myeloma right now, so again, there have been some very, very important and exciting breakthroughs in multiple myeloma and that are tied to specific therapies for specific single nucleotide polymorphisms. So that's certainly something we're very sanguine about and look at from a medical policy standpoint. So the question about the broad array of treatment options in multiple myeloma, and they certainly are increasing. So one of our very important roles as our work with our clinical partners advances and deepens in a truly collaborative way is to provide an analytic overlay. Some of that can be complementary to what the clinical organizations are doing. Sometimes it's very distinct and unique to our data set, and then we can offer that as a way. For example, we offer information to primary care around what they call their medical neighborhood. So which oncologists, cardiologists, urologists are practicing more value-based care, and that can be a way for that primary care office or organization to determine where she or he wants to send referrals. So and now we're talking specifically about cancer. Similarly, we're involved in certain analytics that will help to identify and perhaps predict this notion of predictive analytics. So we're working to harmonize our data analytic efforts with our clinical partners, and cancer care is certainly one of those areas. So the question is, how do I envision targeted therapies changing the landscape in multiple myeloma? I would say that in multiple myeloma, but also in non-small cell lung cancer and in non-Hodgkin's lymphoma. So really in most areas of cancer, immunotherapy, targeted therapies will occupy an increasingly important and prominent role. It's certainly part of what's in this very exciting construct of the Cancer Moonshot 2020, so that we're going to be accelerating the science and the knowledge to better and more precisely target or treat particular types of multiple myeloma. So not all multiple myeloma is the same. So that's where we see some very exciting possibilities, and we're certainly feel like as a payer we're at the forefront in that regard.